Hi, Atul Kamath, hip preservation specialist at Kamath Orthopedics. I want to discuss with you a little bit about hip arthroscopy and hip preservation, give you a little guide on things like hip labral tears and hip impingement. Hip pain can significantly interfere with your daily activities and things like sports. Conditions like hip labral tears and femoroacetabular impingement, or FAI for short, they're common culprits behind these hip discomforts. Here we'll kind of look at some of the details surrounding these conditions, their triggers, and treatments, including things like hip arthroscopy, which will really help you take charge of your hip health and well-being. So the anatomy of the hip is, a ball and socket joint. The hip ball goes inside the socket, and it's a unique joint this way. It's connecting the femur bone, the ball, with the pelvis bone on the socket. And this unique design allows for a very wide range of motion and provides, that necessary stability throughout that motion of the hip. The acetabular labrum is a tissue that lines the joint. It's like a rubber band or a gasket. It's made of fibrous cartilage tissue, and it serves as that gasket to encircle the socket and then envelop the hip joint. It deepens the socket, increases the stability, and also absorbs some of the shock that we see with range of motion or hip activities. Injuries or other causes of impingement in the hip can lead to things like hip labral tears. If the hip impinges and pinches the socket, that labral tissue or that rubber band can get pinched and torn. And that's where we have a hip labrum tear that occurs from impingement of the ball against the socket, or FAI, or femoroacetabular impingement. And this can cause from contact or abnormal shape to the bones, either on the socket side or on the ball side in the hip. And these are fairly common conditions, not simply in athletics, but also in folks who may have a twisting injury, or also some other folks who are a little bit older and may have a degenerative tear from repetitive stress injury. So the impacts of hip labral pain, hip labrum pain can be a real nuisance. We take the labrum, it's a small piece of tissue, but we take it for granted. Things like sitting or walking constantly are impinging this tissue thousands of times per day. So if it's torn, it can really be problematic. Simple tasks like getting in and out of a car, bending to tie your shoes, or participating in sports can become extraordinarily difficult. Research shows that almost 90% of individuals suffering from hip labral conditions describe pain that affects their activities, and including things like twisting, pivoting, or deep bending. Trying to run, dance, or play sports, or even higher recreational activities may feel very challenging or even impossible with a hip labrum tear. And patients often also experience things like mechanical symptoms, what I would call clicking, catching, or a locking sensation, the sensation that the hip is giving way. And that's from that hip labrum getting pinched by the ball and some of the mechanical loss of that suction seal or the gasket that we were mentioning before. The pain is usually deep in the groin, in the area where the hip, the ball, and socket meet, and that's kind of more in the groin. Sometimes you get pain on the outer part of the hip or in the buttock area, but classic labral symptoms is sort of deep groin pain and that kind of mechanical symptoms. And symptoms that intensify or have more discomfort with an active lifestyle. A survey found that 70% of individuals with hip labral tears reported significant decreases in their functional activity due to this pain. So there's a number of non-surgical treatment options available, and this is I always try to discuss with my patients before undergoing any surgical interventions like hip arthroscopy. And so to discuss some of the non-surgical measures for hip labral tears and impingement, these include things like physical therapy. A customized exercise program from a physical therapist can strengthen surrounding muscles, enhance flexibility, work on the core, and restore normal movement patterns. Therapists in certain studies using physical therapy have found a 60% reduction in pain levels and improved function in their daily activities. So this may be part of a first-line approach for treating hip pain and pain that is not amenable to things like basic measures like rest. Again, if a patient is struggling with physical therapy or the therapy is not helping, consider it of a close orthopedic evaluation by a hip specialist. Other common measures include things like oral anti-inflammatory medications, things like Tylenol, Motrin, Aleve. I think these are all great for managing pain and inflammation. Activity modification is very common with hip labral tears. Folks will often adjust their daily activities to avoid painful positions or activities that may be causing more impingement within the hip. However, if some of these activities that you're cutting out are still not amenable to relieving the pain, you should probably see a hip preservation specialist. Another measure that sometimes we use are things like diagnostic or therapeutic pain injections. These may include things like steroid injections or anesthetic injections, not only to ease pain and inflammation in the hip, but also perhaps help us diagnose or tease out hip-related pain from other causes of pain around the hip, like back pain or even other muscular or tendinous issues around the hip. So seeing a hip preservation specialist or orthopedic specialist can help you decide the level of non-surgical treatment measures or diagnostic measures that are needed. If those measures are failing, or a patient has tried some of these measures, or they may have high demands or high activities like high levels of sporting activity, I often discuss things like hip arthroscopy to help address labrum tears and impingement within the hip. The hip labrum is a type of tissue that does not spontaneously heal on its own. Sometimes we strain a muscle or a tendon, and with rest and activity, that tissue can heal. A labrum is kind of like the meniscus of the knee. Sometimes if it tears, it just does not spontaneously heal. So not uncommonly, I do recommend hip arthroscopy procedures for those with symptomatic ongoing pain and a hip labral tear in the setting of impingement. So to discuss a little bit about hip arthroscopy, hip arthroscopy is an outpatient, minimally invasive surgery used to diagnose and treat various hip conditions, including labral tears and hip impingement. This method is best suited for active individuals with preserved cartilage, typically between the teenage years and those in their 40s to perhaps the early 50s. During the procedure, small incisions are made about the hip joint for the surgeon to insert a camera and surgical tools. This allows for very precise visualization of the joint space and the ability to treat things like damaged labral tissues, any impingement areas, or potholes due to cartilage injury within the hip. So the benefits of hip arthroscopy, again, it's minimally invasive, it's outpatient, and for suitable candidates, the benefits include direct repair of the damaged tissue. I can go in there and fix a labrum, allow your own biologic healing response to then seal that labral tear. I can also treat any bony impingement within the hip that may be causing or the source of labral symptoms. And it really allows the patient undergoing hip arthroscopy to return to their active lifestyle. So many patients, the vast majority, 95+% of patients, are able to achieve their pre-injury level of activity, including competitive sports, dancing, or even just daily life activities. So, hip arthroscopy is a technically complex procedure done by specialists like myself, who have done extensive training and have experience in hip arthroscopy. And really, a hip preservation specialist is one you should be seeing for these specific needs. And, in terms of my experience, I've done training both in the United States as well as Europe with respect to open and arthroscopic hip arthroscopy techniques related to the hip. And so I really see this as a powerful tool in my hands to help not only the high-level elite athletes or professional athletes, but also the so-called casual sports or weekend warriors. And then patients working with our teams really have a detailed evaluation, a personalized treatment strategy, and then if undergoing surgery, really have a tailored approach to what is done at the time of hip arthroscopy. So some key takeaways on your hip health. I think understanding the complexities of the hip labrum and then the bony impingement causing labral tears, I think, is essential for anyone dealing with hip pain. There are a range of treatment options, from non-surgical treatments like medications and injections to surgical interventions like hip arthroscopy. And then again, there's a number of imaging modalities and tests that are dedicated and tailored based on your initial evaluation with me as a hip preservation specialist. So hip arthroscopy is an option for you. I think seeking advice from a hip preservation specialist is essential, can really make a difference in your treatment outcomes. And then addressing the hip pain promptly increases your chance of regaining your mobility and I think enjoying your life to its fullest. So really empower yourself with this knowledge about hip labrum and impingement, and then take some proactive steps to toward addressing this hip pain. And I think maintaining your hip health is vital, just not in the here and now, but also hip preservation is looking towards the future. So maintaining your overall active lifestyle, maintaining the overall health of the hip joint, and then really seeking options that are going to support you along this hip health journey. So we'll see you soon at Kamath Orthopedics to discuss hip preservation measures.